We have a very special guest lecturer, Dr. Daniel Vinograd. He's a naturopath and a holistic dentist, and he's been a holistic dentist for 30 years before anybody even had an inkling of what that meant. And he is going to tell you far better than anyone else here could about the interplay between those very things. So please welcome Dr. Daniel Vinograd.
Thank you. Thank you very much. Well, first of all, I'm really pleased to be here, and I always really relish speaking to groups like yours. I relish the patients that I treat because we are talking about people that are becoming aware. We've been sold a bill of goods for so long, and this is part of Western culture. We live in a culture where advertising, movies, constantly we are being told how to think, what to buy, what to be greedy about, what to be scared of. And so it's it's a great pleasure to be in the company of people that are breaking out of that mold. I have been practicing biological dentistry for a very, very long time, and more than I care to admit. And one of the reasons that I did not start practicing holistic dentistry my first 3 or 4 years, I became quite ill around in my late 20s. And I could not understand what was happening. There were mental lagoons and a bit tired all the time. I felt just really not good. And I figured at 28, this is what getting old is about, right? So I figured, I have to accept it. I'm getting older, right? This is what it feels like. Just by coincidence, I read some articles and I realized that perhaps, and I, like many other people, were using amalgams back there, I confess, but that was over 30 years ago. At that point, we're not concerned about a lot of things. We were really basically doing dentistry without masks, without gloves. We're actually taking amalgams and squeezing them into the trash can, the mercury out, and then using it on the patients. So when I actually did some testing, I found that my mercury levels were off the charts. And so slowly I started detoxing. I started doing what was appropriate for this situation. And it took me about 3 or 4 years, but I began to regain my health. And as it is for most of us, we can intellectualize a lot of things, but truly, when we experience something ourselves, then we really become committed. There's really nothing like life to teach us, and nothing like having our own experiences to really get us passionate about something. And so the rest of my life, I've been very passionate about holistic living, and I've been very passionate about holistic dentistry. Back then, 30 years ago, not many people that were actually working with us, and over the years I've actually lived what I preach. I pretty much grow a lot of my own food. I actually have a lot of vegetables. I have a lot of fruits in my area, right on my back door, and I basically don't use a lot of chemicals, both in my practice and in my own home. And I found that that has really helped me. I mean, I'm 85 years old, and no, just kidding. So anyway, when I started 30 years ago, this is the way a lot of my colleagues were looking at me. And, I felt really isolated. And, I was saying, well, why don't you listen to me? I mean, doesn't this make sense, right? So I was being a little bit outside of the conventional mode of practicing dentistry, or even thinking of dentistry. And so I was called a quack. I lost a lot of friends over this, but I began to refuse to use a lot of the dental materials that were being used. So this is basically what I got from my colleagues and a lot of people that I was talking to, you know. There's another one where you have the monkeys, right? And that would be pretty appropriate for this as well. You know, when we get outside of our comfort zone, resistance comes up, right? Who has experienced that? I mean, it happens. It's part of human nature, right? Something new comes up, a different way of thinking, trying to, you know, back off from traditional, conventional wisdom, if you can call it wisdom. Oh. So this is a lot of what I got. Now, I have a very good friend. He was born in Mexico City. He's a very prominent dentist, takes care of a lot of the artists, a lot of the politicians down there, does excellent dentistry. When I was going to USC, he was actually working at UCLA. We still remain friends after that. I don't know if you guys are local or not, but there's a lot of competition between the two schools. And he used to work for the dental materials department. And he would tell me, you know, we're looking at this material and we're looking at the resistance to abrasion. And we're looking at the resistance to compression. And we're looking at the elasticity. And I started thinking, well, is this the kind of lingo that we should be using in something that's going to be going in our mouths? I mean, all we care about is how resistant it is. All we care is about, you know, how long it's going to be in the mouth. And, you know, I mentioned that to him one time, and he said, what are you talking about? What are you talking about? I mean, you know, we're really working on teeth. And this is really the way that we're taught in dental school. We basically get a patient in, we focus on the teeth, the rest of the patient becomes a blur. So we become technicians, engineers of sort, but you know, I mean, if we are going to be called doctors, we need to be healers. We can't just be technicians. So as a result, we developed in this country and before some of the most toxic materials that we know of to actually place on people's mouths. I have been fighting for amalgam to be banned for years, but unbeknown to us, pediatric dentists, general dentists are still using formocreosol on children routinely when they need a quote-unquote children's root canal, which is really called a pulpotomy. You know, formocreosol is basically formaldehyde. And you know, you take some formaldehyde, you actually dab it and place it inside the child's tooth and let it sit there. We know formaldehyde is a known carcinogenic. Why are we doing this? Because that's the way we were taught. Root canals, the same thing. You know, we have a number of problems with root canals. One of them is the toxicity of the materials. The second is the shrinkage of the material. So when we are sealing a root canal, if the material shrinks, it's going to create a lot of space for bacterial invasion. So let's go back to Mercury. Amalgams were actually developed around 1830 in France. In about 1833, we were blessed with the French bringing the amalgams into American dentistry. They were very, very well received because we really didn't have a material then that we could put in people's teeth, in people's mouths, and was resistant and was solid, and we could really rely on it from a physical point of view. So amalgam was embraced, and all the dentists, a few years later, about 50% of all dentists were placing amalgams in people's mouths. And mind you, amalgam is 50%, approximately 50% mercury. And mercury, as most of you know, is probably the most, one of the most toxic elements known to human. I want you to take a minute. Can you guys all read this? Is that clear enough or not quite? Okay, so the top part is really a manufacturer's disclosure. This is what the manufacturers have to actually disclose to you for the product that they are selling to dentists. Now, the bottom chart is actually the US Department of Health and Human Services is ranking the most toxic elements that we are aware of, and mercury is number 3 of all the elements, of all the toxic elements that have been tested, number 3. Why in the world are we still using mercury in people's mouths? Well, one answer could be because we go with what we know, right? Dentists go with, now I was taught, when I questioned this in dental school, I was taught, hey, you know, there's really nothing to it, you know, you guys are worrying too much about this, and you're really truly just a health nut. And you know, I started hearing that from my kids too a lot. So I said, all right, well, listen, I mean, perhaps I'm being a little extreme here, but this is what I get to see every day in my practice. This is years and years of dentists using amalgam in people's mouths. Not only are we getting the mercury leakage into the body, but we're also, in addition to that, getting teeth cracked. The amalgams actually expand with time. They leak and then actually start cracking the teeth. So even a lot of dentists, fellow dentists that don't believe in the harm of mercury, sometimes are convinced by the fact that I do probably 10 or 12 crowns a week from people that have actually broken teeth from the amalgams. So there is another toxic restorations. You know, they're basically oxidized, their margins are open, and I don't know if you can see clearly on that picture, but you see the crack lines as well on this mercury fillings. When we remove them, this is a kind picture. I end up finding a lot worse than that right underneath the amalgams. And on that slide on the right side, you can actually see the crack lines on the amalgams once you remove them. And this is once the amalgams have been replaced. Now, wherever you come from, wherever you do, you really have to look for somebody that is not just a holistic dentist, but that really understands the physiology and the biology and is treating you as a human being. There are a lot of dentists now that have jumped on the bandwagon, and they call themselves holistic dentists. But you have to make sure that this dentist truly is taking the pulse of your whole physiological, anatomical health picture. And, you know, a lot of people that used to call me a quack now are following. Okay, any questions about this?
Is composite an amalgam also? Composite, dental composite?
Right, what is the question?
Is that also an amalgam? Does that have mercury in it?
No, composites do not have mercury on them. They do have their challenges. Composites, most of the composites in the market have BPAs. So you also have to be somewhat concerned about BPAs. It's not a great material, quite superior to mercury amalgam, you know, as far as the load on your body, but they also have some problems, composites. We usually will use composites in very, very small fillings that don't have a lot of attrition when you masticate. Optimally, you want to replace the you want to replace the amalgams with something that has been baked, like a porcelain.
Quick question over here. Can you recommend any dentist in the Atlanta, Georgia area that you know of? Any colleagues, friends that you know that's truly a holistic
I
dentist?
don't. I'd be happy to look for you. If you want to email me, I'll be happy to be in touch with you and try to find somebody for you.
Do you want to wait until you're done to take some questions? Because it could be that some of the things that people are asking, you're going to cover in
Yeah,
your
so if you
lecture,
have
too.
questions specifically about amalgams,
Right.
about silver fillings, I will take them now. And
Before you asked if there were questions, you ended with a comment that it was very important to find a holistic dentist who knew about your anatomy and physiology and things, and you said that's very important. Why is that important?
you are a human being, and everything is interrelated. Since the Industrial Revolution, we actually learned to compartmentalize things. We have specialists in this, specialists in that, and your body becomes a series of pieces that get separated. You have to think about the fact that everything that you eat goes through your mouth. Everything that all the bacteria in your mouth is really having some kind of a relationship with the rest of your body. And we're going to go into that in a minute. But we cannot really separate the mouth from the rest of the body. It's just one thing. And we have to treat it like that.
Do they use amalgam in the crowns also? Because I know when I had crowns, if they weren't completely porcelain, I had to choose a metal. And depending on the metal, is like the lowest base metal amalgam?
No, the amalgams are not used in the crown itself. Often, when a dentist prepares a crown, if there's an amalgam in there and the structure of the tooth includes an amalgam, sometimes they will leave the amalgam in there just to maintain the integrity of the tooth, rather than removing it and replacing it with something else and then placing the crown. So we find a lot of times that we take a crown off and we find amalgam, silver fillings underneath. A very difficult thing to really assess, because when we are very conservative with x-rays, but when we do have to take an x-ray to see what's going on, most of the metal crowns will not allow us to see inside to see whether there's a silver filling or not. So if you ever have a crown, you have to make sure that you ask your dentist to remove all of the amalgam and hopefully do it in a safe manner. As far as the crowns themselves, the metals on the crowns vary significantly. You have probably on the most biocompatible end of the spectrum, you have some pure titanium, which is now being used more and more. And then you have non-precious metals, which it's mostly nickel, lead, and a few other, quite toxic metals that are used underneath, and then they bake the porcelain on top most of the time. Does that answer your question? Okay. All right. So let's talk a little bit about your question. Everything is connected. So, what we learn is that you have a dentist, you have a doctor. You have a specialist in this, you have a specialist in that. We are beginning to get a lot of research back showing how much we really are interconnected and how much oral disease is affecting systemic disease. So these are we have quite a number of studies on heart disease, and even though the American Dental Association just came out and said that there is really no relationship between gum disease and heart disease, in my opinion, and I'm sure I'm going to get in trouble, but it won't be the first time in my life, I think this is a political position. I think a lot of dentists misdiagnose or do not diagnose periodontal disease. And if they take the position that it is linked, then there's liability involved for the dentist for not diagnosing periodontal disease. So the other study that just came out probably 3 or 4 years ago is linking, again, periodontal disease, gum disease, with So the initial stages of gum disease looks like this. So if you begin to see some bleeding in your gums, you begin to see some pocketing in your gums, and a little bit of redness, this is the beginning of periodontal disease. And of course, more advanced stages, you begin to have a little bit of bone loss and more pocketing. So if you see on the left side, you have a gingiva, a situation that is normal. On the right side, you have actually already a periodontal pocket that has been formed. And right on the bottom of that pocket, you have bacteria that are having a great time. They're throwing a party, and they're untouched. Once you have 2 or 3 millimeters of pocket depth, you can get in there with a toothbrush or a water pick and clean those out. When you have 4, 5, 6 millimeters of pocket depth, you can no longer reach those bacteria, and they're basically home free. Now, what's really interesting here is that they have found the same bacteria on the bottom of those pockets, which are basically anaerobic bacteria, which means bacteria that do not need oxygen, versus aerobic bacteria. We have both in our mouth. We have oxygen-loving bacteria, and we have oxygen-hating bacteria, bacteria that actually proliferates without oxygen. When we start having gum disease or rampant decay, the anaerobic bacteria proliferates. So this part right on the bottom of the pocket is pretty much shielded from oxygen, and so the pathogenic bacteria really starts proliferating in that area. So what is interesting is that the same bacteria that starts proliferating when you start having pathological, either periodontal or decay-related disease, were found the exact same bacteria were found in diseased hearts and diseased pancreas. Those studies that I mentioned to you before, the pancreas contained the exact same anaerobic bacteria. So I don't know, you can claim that it's not related, but it seems pretty suspicious to me. Here are some of those bacteria that we seem to have in common. And it's quite logical. You know how quick a bacteria can get from the mouth into your heart? This quick. It's just all it needs to do is get into the bloodstream. So for us to start thinking that the mouth is separate from everything else is just a fantasy. It really is not true. Now, this is when it gets interesting. So you say, all right, so what can I do, right? And most dentists will say, well, come see me every 3 months or every 6 months or whatever, every year, and I'll clean those pockets out for you. And then you come back again in 6 months and I'll clean those pockets out for you. But if you really think about it, how much can I do for you once every 6 months when those bacteria are having a party in there, right? Of course it's a good idea to come in and get professional cleaning, but traditional hygiene, important. When your pocket depths are smaller than 3 millimeters, this is quite successful. You use that, you use the floss, fairly traditional. And what I think I can bring to you today is some less traditional ways of actually dealing with your oral hygiene. How many people here are familiar with ozone therapy? Okay. So ozone, O3, oxygen, ozonated, can actually be infused in water. It can also be used by itself. And we find that when we inject ozone into an area full of anaerobic, pathological bacteria, what do you think happens? Yeah, right. They hate oxygen, right? We do have aerobic bacteria that like oxygen in our mouths, but those are not the ones that are actually prolific in disease. So for us to actually bring oxygen into our hygiene program, concentrated oxygen is a slam dunk, in my opinion. Some of those ozonators or ozone infusing machines used to run a couple $1,000s, probably 15, 20 years ago. But nowadays, you could probably pick up a fairly good machine for less than $100. When you combine that with a water pick, you have one of the most efficient, and don't tell all your dentists about this because they're not going to like it, but you're going to be your own dentist, basically, and you're going to be your own dentist every day. You're actually going to be cleaning those, infusing your mouth with oxygen, basically, every day. So what you do is you purchase a water pick, and you will infuse the water with the ozone for 20 to 30 minutes. And if you would like to email me, I can give you some of the specs of what you need on that ozone machine. And basically you irrigate your teeth and your gums every day. So we found obviously you don't want to have pockets larger than 3-4 millimeters. And obviously you want to go to the dentist, make sure they're cleaning, they're removing all the tartar and so forth. But this therapy has been quite successful in my practice. We've actually placed I just recently had a patient who came to me and said, "Doc, I haven't been to the dentist in 20 years, and this is what I have." And I looked in there, she had maybe 7 or 8 teeth with 9 or 10 millimeter pockets full of pus. And I said, you really, really need to remove these teeth. These are really hurting your health. There's no way that you can have that much pus, that much inflammation. You have bacteria fest in there, and it's going to affect your heart. It's going to affect the rest of your body. I said, "Doc, I just can't go there." I said, "Well, all right. I mean, it's your mouth. I can't force you to do it, but I would highly recommend that you get that taken care of." And we actually placed her on a regimen of ozone with a water pick twice a day. I actually had her back 3 months later. The inflammation had been reduced probably 90%. There was no pus whatsoever. She still had large pockets. The 9 millimeters became 7s, which is still not okay. But, it's a tremendous tool for you to use at home. And obviously, you still want to have pocket management by your dentist. Anytime you really should insist that your dentist always checks the pocket depths if they're not already doing. A lot of dentists are very good about doing this, and I hope your dentist is doing this for you. And anything that is over 3 millimeters, you should identify. You should talk with your dentist about showing you which areas are over 3 millimeters, and they should be actively pursuing cleansing that area on your own. Okay, and I think most of you guys know this, that it used to be that you would go to the doctor and the doctor was well respected, and whatever the doctor said, you actually took as the last word in the gospel, right? It's not that way anymore. There are a lot of wonderful doctors, a lot of wonderful dentists, but there are also commercial interests that have entered medicine, no surprise. And you have to be your own advocate. You have to ask questions, as you know, and you really have to take charge of your own health. Okay, I'll entertain any questions you guys might have. Yes, please. What's your name? Blake? Yes. Hi, Blake. Yeah, we actually do work with hair payment plans. Really, I've been doing this for over 30 years, and I want to help people. Yeah. Well, if you have something that looks like silver, you know, if it walks like a dog and it quacks like a dog, it's probably a duck. But anything that looks silver in your mouth, most likely than not, is amalgam.
Okay.
There's amalgam silver fillings. Is your question whether you have it underneath
Or
your crowns or just
the fillings itself? Is
Yeah,
it
if you can
mercury
see the
fill-
fillings, if they're not tooth colored,
It
more
is.
like 98% chance that those are going to be mercury silver
Okay.
fillings.
What kind of questions would you ask a dentist, and how do you know that? Because someone mentioned earlier that, you know, you have to remove it safely. What is the procedure when you say?
Okay, so a little bit like removing an amalgam from mouth is a little bit like removing asbestos from a ceiling, right? If you remove it and you're not careful, you can just really spread all the toxic elements into your environment. There are different ways to do it. There are different protocols. Al Higgins, which is the father of a lot of this work, has a protocol. International Academy of Oral Medicine and Toxicology has a different protocol. So you could ask them if they follow one of those protocols. A lot of patients ask me what protocol I follow, and over 30 years I've developed my own protocol. And the most important thing for me is that you have high power vacuum, that you are wearing some kind of protection and oxygen when you're getting that done, and that you have a very well-placed rubber dam. Does everybody know what a rubber dam is? Yeah. So you want to make sure that, so people ask me what kind of protocol. I say, well, the protocol is important, but if you have the best protocol and you don't lay down a rubber dam properly, it doesn't matter what protocol you're using. So you just want to make sure that you have somebody who's meticulous about doing this. In our practice, we also use homeopathics as a second line of defense, and we use HEPA filters. So there are two things that you're really concerned about. One is that the amalgam is actually separated, so it comes out in chunks and you're not really grinding all that out, number one. Number two, you're concerned about intake, re-intake of the amalgam powder. And then the last one is you're also concerned about some of the vapors that you're creating while you're cutting the amalgam. We actually use low speed with lots of water, so we minimize the amount of vapors that we create through the heat process as we're removing and cutting the amalgam.
How many, before you go on, how many people in here saw The Beautiful Truth? And remember the smoking tooth part of it where he scratches the dental? That's what he's trying to avoid in his procedure.
Does that answer your question? Yes.
His question was, what's a rubber dam?
Rubber dam. We basically have it's actually a rubber piece, and you create 1 or 2 or 3 holes, depending on how many teeth you're going to, and you actually isolate the tooth and prevent anything from going inside. So it would basically, I would have brought a picture of one if I had known that. But yeah, basically you're isolating. It would be a rubber piece that isolates, let's say, 1 tooth, and we actually use something to seal around it. So everything that is coming out of the tooth actually gets suctioned out, and it prevents physically the powder, the water, anything from going back into your system.
I see you. Dr. Vinograd, I don't know if you're aware of this, but you're now beaming to about 20 countries around the world. And some of them are emailing in question or sending in questions for you as well. A couple really good ones here, referring to the ozone treatment. Is the ozonator treatment similar to using food-grade peroxide with water and a rinse?
No, not at all. Not at all.
Okay.
I believe that the ozone is quite a bit more efficient.
Okay, and then the second one is, where can they find the ozonating machines?
You can really buy them online.
Okay.
You can buy them online. And you basically want something that will have a reasonable output. A lot of the ozonators that are being sold, even by some health companies, have such low outputs that you really would have to put that ozone generator in water for 6 or 7 hours before you have some kind of efficient. But if you get something with is 600 milligrams per liter or higher, you can probably ozonate the water for about 20 minutes and it'll be efficient, effective for you. Keep in mind that you have to use this water immediately. The ozone will dissipate, which is why the big companies have not packaged that and sold it to you for $1,000, right? You have to use the water immediately.
And can somebody who, if people have bridges in their mouths, can they use that method also?
Absolutely. Absolutely. This is a great tool for just keeping oral hygiene, even if you don't have a lot of disease. 600 milligrams per liter.
My dentist likes to insist on an x-ray every year, and I resist. Could you talk about that a little bit, please?
It's somewhat problematic. I don't care, you know. I mean, if I'm going to have a problem because I didn't take an x-ray when I didn't think an x-ray was necessary, I'm willing to live with the consequences. But where do you live? Okay. So in the US, we have a problem because we have a liability problem, an issue with liability. I will take an x-ray because I do have to live by some kind of standards of liability. I will take an x-ray when I suspect there is a problem. But I will first look at your tooth, see what the problem is, and then if I have any questions, I will take an x-ray. Traditionally, I do not take x-rays when I don't need to or when I don't suspect there's a problem. If somebody hasn't had x-rays for maybe 5 or 6 years, then I think it would be understandable and commonsensical to take x-rays. And definitely for those of you who have children, the latest study on radiation on children is just mind-blowing. The amount of radiation that children are receiving worldwide from the dental office is just astronomical. So you have to remember their bodies are small, they're tiny bodies, and the same amount of radiation that I would use to take an x-ray for you is the same amount of radiation that I'm actually using for the child. And so proportionately is a very, very high concentration of radiation for them. So in our office, we do not take x-rays on children, again, unless there is a real need for it.
Do you have the same question?
With the porcelain fillers, could you talk about how durable they are?
Porcelain?
Yes.
There are different kinds of porcelain in the market. You have Emax porcelain, you have Bruxer crowns. I mean, there are just a number of them, and different crowns are actually made in different ways. In our office, what we're starting to use a lot more is called a Bruxer crown. And the Bruxer crown does not have alumina, and it's purely a zirconia crown. Has two advantages. One is that it's very strong, so you can actually you don't have to be as aggressive reducing the tooth. And number two, they're incredibly durable. I mean, you can take a hammer to them, they won't break. So Bruxer crowns, in my opinion, is really the new paradigm. How long should they last? That was the question. You're talking about porcelain only or porcelain fused to metal? Only. You know, it just really depends on how meticulous that crown was constructed. It's like everything else. You could say, how much should this carpentry job last me? You know, it really depends on how meticulous your dentist was in preparing your crown, how meticulous your lab was, you know, and make sure there are no impurities in there. As an average, a crown, just a general crown in the US, lasts between 5 and 7 years. My expectations are a lot higher. I don't want to live by averages, and we have crowns in the mouth that have been there for 20, 25, 30 years. Porcelain only, I would say about 20 years is my longest crown right now.
Will ozone water, will that help root canal teeth, like deep, like in the canals if there's an infection, or
No.
will it only help with surface?
You actually really, if you think about what we're doing, is we're actually taking concentrated O3 and killing the bacteria physically, which I think is brilliant. You know, we continue to want to use antibiotics to beat bacteria that are much smarter than we us, evolutionary-wise, and keep on beating us biochemically. So, there are ways that we could use other methods, and in this case, we're using just a physical attack on the bacteria. So you do really need the contact. You need the oxygen to actually kill the bacteria. You would have to, really, in order for that to be the case, you would have to actually open the root canal and really infuse the water into the canal itself. So if you have a root canal, that would not work. Sorry.
Doctor, along those lines of root canals, when do we have to get a root canal extracted? When do we have a risk of, even if it looks good, the tooth, should we get it extracted or not? Thank you.
That is really the biggest conflict I have in my practice. I usually will assess a patient, their general health, and the situation of that particular tooth. If you have a patient that's the only tooth that they have in the back, and their health is relatively good, I will consider not extracting it, only because what are the options? Put them on a partial, it really decreases the quality of your life, it affects your health in other ways. Implants, we're talking about inserting, everybody's crazy about implants, and I do limited amount of implants in my practice, but you're really inserting a piece of metal, titanium, into your bone. So all the people that are crazy about doing implants right now and are doing them in every case, not necessarily, in my opinion, is best for your health. Otherwise, if the root canal was done, we have now materials where you can actually do root canals in a much more biocompatible way. And when I really have to, and there's a tooth that I need to save, I will do a biocompatible root canal on that tooth, which implies using materials that no longer shrink, that actually seal properly, and that we don't have the actual large number of bacteria that were actually being lodged in the canals. Having said that, I would always prefer not to have root canals and not to have root canal teeth in my mouth. So if they're not strategic, I often will, and the patient has some health issues, I will recommend extracting it and replacing it maybe with an all porcelain bridge. The old root canals, they all basically have been done with fairly toxic materials and materials that actually shrink. They use gutta percha, which is a physical, it's basically a rubber, and they are actually sealing the canals with a combination of rubber and some kind of a paste, a sealant paste, which most of the time is fairly toxic. So that's probably one of the most difficult things I have to live with every day. Yeah, but
Let's repeat that question so everybody can hear.
Absolutely. We're being asked if the procedures that are done by biocompatible dentists are covered by insurance. I would say most of the biocompatible, we don't do that in our office, but most biocompatible dentists have additional fees for oxygen, a rubber dam, etc. All the things that need to be done around this. The actual restoration is no different than a non-biological dentist would do. So the insurance company will cover that part, or whatever part of your work. Getting back to your question, again, if I have a patient that is really compromised, we have somebody who's challenged by either cancer or some other, important health challenge, at that point then you have to really start thinking more about, the risk-reward ratio here changes. So somebody has issues like that, I would definitely most cases remove the teeth unless they were done with biocompatible materials.
Yes, doctor. Somebody has a lot of amalgams in their mouth.
I'm sorry?
Somebody has a lot of amalgams or the mercury fillings, and they don't have a chance to get them out, or they're waiting to find a dentist like you. Is there something they should or shouldn't do dietary-wise or supplement-wise to help their body, or not to make it worse? Or?
You mean to just go to your regular dentist and get this done.
No, I mean, if you're waiting to find a dentist, or you can't do it right now
What can
because
you do
of the therapy?
in the meantime?
Yes. Is there something else, or you can help?
You know, it depends on the condition of your amalgams. If your silver mercury fillings are actually leaking, like, you know, if they're older, the margins have already cracked and they're leaking, a lot of people start chelating, and all they're doing is actually chelating and extracting more of that mercury from your mouth. So it makes no sense to do that. I would say if you're not leaking and you have a high mercury content and you want to chelate, that would be fine. But as far as anything else that you could be doing to protect yourself, you know, because it is a physical problem that's creating this, there's really not a real lot that you can do. You can use some, I mean, vitamin C in large concentrations tends to be helpful. I would not chelate. I would just protect, not chelate. And obviously get them out as soon as you can properly.
I had two questions. The first is there any kind of safe dental implant you can get? And the second question is, would you recommend dental like a conventional dental cleaning if that's all you have access to?
First part of the question, is there a more biocompatible implant? Is that fair? Yes. In Europe, they have actually been using zirconia implants, which are non-metal. From a biocompatible point of view, I think they are a little bit better than the titanium. The problem is that they have not been used for that long in this country. They are just getting to be FDA approved. There have been some instances where the implants have actually cracked. So it's still questionable. I still would not bring those into my practice at this point. Second part of the question is getting, I mean, you could have your dentist do regular cleanings. You know what I mean? You should insist that they don't use fluoride. You can make your own prophy paste and bring it if your dentist will allow you to do that. We actually make our own prophy paste in our office, and we just use a base of virgin coconut oil and a little bit of xylitol and some flavoring, a little bit of pumice, and that's all you need. You know, I mean, I would give that to eat to my grandkids. I would have no problem having spoonfuls of that eaten by my grandkids.
Xylitol.
Xylitol, yes.
Pumice.
Now, if you're going to use that for your own toothpaste in the house, I would minimize the amount of pumice. Pumice is a bit abrasive, and we use it in the office because we do this for you every 6 months. So we use a little bit more of an abrasive paste. If you're going to do this as your regular toothpaste at home, I would either reduce or eliminate the pumice.
Could you be a little more specific about the negative aspects of a tooth implant? Is it because of the titanium, or is it because of the way it's put in the jawbone, or what?
The titanium integrates fairly well into the body, and if I was going to have a metal in my body of any sort, it would definitely be titanium. It's the most biocompatible metal that you can have. A lot of people that claim from just an electromagnetic point of view, from a Chinese medicine point of view, that you're actually disrupting the flow of qi, you know, when you're getting large pieces of metal into your mouth, into your body. I would say if it's going to really improve the quality of your life and you don't have any problem with metal allergies, that probably would be the best solution. There's also a problem with the interface. And I would say that would probably be my biggest concern, is the interface between the implant and the gum. The implant tends to integrate quite well to the bone. As a matter of fact, when we actually place an implant, in our office we wait 3 months for it to have full integration. However, when you actually place the crown on the implant, you're creating a space between the implant and your gum. And unless that's really well managed, it could create the same problems we were having before, we were talking about before, as far as having a lot of anaerobic bacteria getting involved in that area and then creating systemic problems.
Hi, doctor. Can the dentist put a implant even though you don't have bones?
If you don't have?
Bones.
Bone. It just depends. You know, everybody has some bone. There are some implants, there's some shorter implants called Bicon implants that are just as stable as the longer ones that sometimes prevent people from getting implants. If you're going to get a long implant, if you didn't have enough bone. So using the shorter implants, we tend to see a lot more.
In this case, the bone is very thin.
It's thin and the quality of your bone is not good?
Yeah.
You know, if you have an option, I would definitely look into getting some porcelain bridges. But if it's something that you need to do, the only way to do that would be to actually do a bone graft and increase the thickness and quality of your bone, and then that could be done.
She said you're not recommending it in this case, though.
You know, it's a case-by-case situation. If you have the option of doing a porcelain bridge, that's what I would do in my mouth. Non-metal porcelain bridge, maybe if it's a short span, do a Bruxer bridge. For me, that would be the most biocompatible solution. If you don't have that option, then you have to look into perhaps bone graft.
Okay, my question is this. Hi, how are you?
Hi.
In my field of work, I am in front of cameras and pictures and things like that. How do you feel about teeth whitening? Because my smile is always important.
Right.
With my job. Is it dangerous?
No, not really. It's basically just very concentrated hydrogen peroxide. From a biocompatible point of view, no, really not a problem. You want, sometimes you get sensitivity in your teeth, and you have to manage that. But yeah, I wouldn't be that concerned. We have so many more. We have much bigger fish to fry. Not really.
I was wondering, I know that on my crowns that the amalgam was removed, but I know at least the last one I got, all of it wasn't, because when I saw the tooth, when they took the temporary off, I could see little spots. Do you suggest pulling off all those old crowns and getting every little spot? And then also on the crowns that have the porcelain fused to the base metal, do you suggest having those replaced, or if you're in good health, is that fine to leave them?
Do you have an option, or you have a way to find out what metal was used on those crowns? If you can find out, unless it was titanium and you have some kind of a health challenge, I would get them replaced by Bruxer crowns. The first part of the question, often the amalgam, when you remove an amalgam, as you saw in one of the, you get decay underneath, and you get something else which is called amalgam tattooing. So the amalgam will actually stain the tooth. In our office, what we do is we actually have a vegetable dye that we place that will actually mark for us the actual decay, and we remove that, but we don't actually remove the tattooed tooth, because the silver is not a problem. You know, people use colloidal silver all the time, and it's a well-known antibacterial that people use quite successfully. So the silver is not the problem. And if what you're seeing is the staining of the tooth by the amalgam, that is not a problem. However, if the actual physical amalgam piece was left, I would have that removed. If you
The
have a good rapport
question was, how would you know if they were careful?
Yeah, if you have a good rapport with your dentist, it's all about the rapport with your dentist. You know and a lot of the dentists are great people. They're thorough, whatever, but they sometimes don't have the consciousness of saying, oh well, I leave a little piece of amalgam, it's not a problem, because they don't understand what the side effects, the harmful effects of that is. So, but if you have a good rapport with your dentist, I would have a conversation and find out, did you remove that? I'm concerned, and ultimately, if a metal that is not titanium was used, you might want to take it out and see what's underneath anyway.
If your pockets are, right, if the pockets of the gum are 3 millimeters or less, can you brush with baking soda and kill the bacteria? Do you find that that's effective?
Yeah, you can use baking soda. Really, truly, what you use is not so significant. I actually have my patients brush with a soft toothbrush and water. That's it, when it comes to the gums. Afterwards, when they're done, I say, if you want to now brush your teeth with a toothpaste, hopefully something that you make at home or something that is clean and healthy, then you use that toothpaste at the end to brush your gums. What we find is that most people don't spend enough time brushing their gums. You actually want to get the bristles of that tooth brush into the pocket. You get it at a 45 degree and you really want to physically get into the pocket. When we use toothpaste or anything else, we tend to want to rush through because we want to spit, we want to get it rinsed, we want to get it over with. But if you just use water, you can sit, listen to music, if you watch TV, whatever you want to do, and sit and really work your gums really well and get those bristles physically to remove the bacteria. It's really just a physical removal of that bacteria that really matters in this case.
I read that baking soda kills bacteria, but that's not.
What's that?
He said he read the baking soda kills bacteria.
Yeah, you can use baking. I have no opposition to baking soda, but baking soda kills bacteria, oxygen peroxide kills bacteria, ozone is more efficient than any of those two things, kills bacteria. You can use it for sure, it's helpful. But what I'm saying is that really, if you're gonna use baking soda and kind of brush your teeth very quickly, you're not gonna be as efficient in reducing periodontal disease as if you really sit down and spend time physically getting those pockets and the bottom of those pockets reduced. You can go 3, even 4 millimeters sometimes and be efficient.
Hello, doctor.
Hi.
Have you worked with Gerson clients, and have you seen improvement with these clients over the period of time that they used the therapy, and how did their mouth look?
I have seen Gerson patients, but not for, I haven't really been following for a long period of time. My relationship with Gerson Institute is probably, 7, 8, maybe a year old. So obviously we're doing what we've seen works in other patients before, but
He's treating the staff, however.
If you ask me, maybe down the line. But I do, because of what I do treat a lot of patients that have a lot of very challenging health issues, and so a lot of cancer patients over the years and so forth. And we try to see them as a whole. We try to get the dental part done and also receive them in a way where they're feeling validated and supported.
Thank you, doctor. I think I heard you mention that we want to go with a dentist that I thought I heard you say doesn't use fluoride. I understand we don't want to ingest fluoride. Can you clarify, do we ever want fluoride in our mouths or not?
Usually a dentist that uses fluoride, and I'm not going to say all dentists, fall into this category, but usually a dentist that uses fluoride does not have the kind of outlook that we want. Fluoride is basically quite a toxic element as well, and it's actually quite inefficient in really helping you once your teeth are out. For that fluoride to penetrate a grown tooth and have any kind of positive effect is really a myth. It's insignificant, the benefit you're getting from it. The only time you really get a lot of benefit from fluoride is if a mother that's pregnant ingests it. I'm not suggesting that you do that, by the way, but if you ingest it and that becomes part of the fluoroapatite that is the structure of the tooth, then you can have a much greater effect on that tooth resisting decay. Now, if you use too much fluoride, you can get fluorosis, and that's a different problem. You go to the other extreme. But I'm not suggesting you do that, because I think the health challenges with fluoride are much greater than the benefits, number one. That's another thing that dentists have been using for years. It's become part of the status quo, is what dentists do. Without really thinking, we're really not thinking about it. Fluoride has been linked a lot with some challenges some brain disease, kidney disease. So I just don't think the benefits really warranted. Absolutely. Absolutely. And anybody who's a holistic dentist or has some kind of a naturopathic inclination really understands that.
Well, first, as an input, when we were learning reflexology and the meridian points, each tooth is at least connected to 3 important members of the body, like kidneys, liver, and so forth. So it's very important, and I appreciate your thought about connection. And I was going to ask if we can have email or any address from you and be in touch if you have any question.
Yeah, absolutely. You can be in touch with me. I'll be happy to answer your questions. And thank you for bringing that up.
I think they want you to give you, they want you to give them your email.
Okay, I'll give you, if I give you my office email, you can use either my office email or you can actually contact me directly. And it's D Vinograd, D as in Daniel, Vinograd, my last name, V as in Victor, Inograd. Again, D at the end is in Daniel, dvinograd@gmail.com. That would be my direct email. Or you can contact my office, Alpha, ALPH, Alpha Dental, SD for San Diego, @gmail.com. I'll be happy to try to help in any way I can.
Dr. Vinograd, is there a website that you would recommend they go to perhaps answer some of the questions before they email you, and also a website where they can find dentists in their area who would be like-minded?
And there are a number of websites that actually recommend different dentists. Some of these websites, all you need is to pay a fee and you get listed. So I would feel more comfortable if you email me and I actually can guide you a little bit through the process. Yeah, I would say I would prefer to do that. You can use it every day. You can use it every day.
Hold on, the question was, how often can you use the ozone treatment?
Yeah, it is a little bit time consuming, so you have to actually, and the ozonator actually, the ozone infuser works a little bit like a diffuser on an aquarium. It's pretty much the same thing, the way it looks. It's not actually outputting the same thing, but it looks exactly the same thing. So you just place that on your container, and you really have to let this infuse for about at least 20 minutes, depending on the power of your machine. So, if you're very committed and you want to do it 3 times a day, that's great. But no, not really. And I suggest that 1 time a day is enough to break the cycle, because you're really killing all this bacteria once a day. They really don't stand a chance of reproducing. Cultures don't reproduce that quickly.
Hi, I wanted to check, I'm using a sonic toothbrush because my dentist recommended it, but now it seems old-fashioned might be better, so I wanted to check that with you.
It's just what works in your hands. Sonic is fine, but again, I would use a soft brush with it and use it just with water, and first address your gums. Just 45 degrees and just work your gums very slowly. Make sure you're really accessing the gums, the pockets. And then I would do a second stage to this, which is the flossing. And third stage, I would actually use whatever toothpaste or whatever you feel comfortable or feel good with and brush your teeth as a separate. It's a little bit of an investment of time, but it's well worth it. You will save lots of time, health, and a lot of fees with your dentist as well.
Two real quick. How bad is gold crown in the kill you spectrum?
Gold? I think if it was plain gold, I think it would be better than titanium. I think it'd probably be an excellent metal if you had to go with a metal in your mouth. Some of the challenges are, number one, that gold is really not used Am I answering your question?
Yes.
Yeah. So gold is really not used as pure gold. It's actually an amalgam of a few metals, because gold by itself would be too soft to use on the mouth. So once you use it for dental purposes, it becomes a little less benign than if you would use gold alone. Second is that if you have anything other than gold in your mouth, with the saliva you begin to create galvanic currents, electrical currents in your mouth. And that's not a healthy situation for you. And lastly is we have now porcelain materials like the Bruxer crowns that I'm talking about that don't have a lot of the challenges that metals do. So I don't use that anymore in my practice, although I did when I first started.
Also, has it been, I know it's been hypothesized, I don't know if it's been proven, that there are serious threats to pregnancy from gum disease now. Is that correct?
You know, I wouldn't be surprised. I haven't seen that research, but I would not be surprised. I mean, whatever is diseased in your mouth is going into your bloodstream and it's affecting every organ of your body.
Hello.
Hi.
I wanted to ask you about flossing. Is there a floss which you recommend? Because I find it difficult sometimes to floss my teeth, and sometimes the gums are bleeding because the teeth are too close together. So is there a floss which you recommend?
You know, I personally just use plain silk, without anything added to it. I would definitely not use any waxed floss, because what you end up doing is creating a great culture for a great media for bacterial culture to develop in there. So I would not use anything that is waxed. A lot of the times when we have bleeding from our gums is because we're flossing straight down. And you want to actually just go by the contact, click the contact, and then you want to just shoe shine one side and shoe shine the other side. You're actually really flossing both teeth. You know how you have your gum has like a triangle in between? You want to floss on both sides and not straight down. If your gums are your gums bleeding anywhere else, or just when you floss? Yeah, so maybe in the technique, not so much the floss. You want to make sure that you're not really just because you're pushing hard to get through. You're actually going right into the center of the gum and making it, and really creating some trauma to your gum rather than cleaning it.
Hello, I'm Priscilla, come from Australia.
Welcome.
Lots of the patient come to tell me about coconut oil. It's very good benefit for the gum bleeding or the tooth problems. Can you describe more about the coconut oil for the tooth problems?
Do you mean oil pulling with coconut oil? Is that what you mean?
You're talking about why we use coconut oil as a base for our prophy paste?
For the what? For the paste. Why you're using coconut oil for the paste, I think she said.
Yeah. I mean, we find that the virgin coconut oil is just, it's a magnificent base to use. I use it in my diet all the time. It's actually antibacterial, and it actually enhances the fact that it's an oil. It really enhances the ability for your gums to heal. It's just a very good base. I mean, it's nothing magical. We just use it as a base because it's a very healthy oil. And it provides a good media for us.
Okay, we've got one more. And then I know we could keep you here all day, and probably some people want to take you home in their suitcases so you can keep answering questions, but that would be unkind.
Well, I'm happy to be here.
Hi, I wanted to ask about removing amalgam fillings. I went to several doctors in India as well as here, but generally in India because it's cheaper there. And I was told that if I get the mercury fillings out, the amalgam fillings out, it might be so wide, the fillings, that I'll have to do root canal. So that's one of the reasons why I'm a little bit hesitant to sometimes get my mercury fillings out, because then it might land up, if the filling is big, then it might land up in doing a root canal.
Yeah. Again, it depends on how meticulous the operator is in removing the amalgam. There are two problems that could create a problem with that will require for you to have a root canal. Number one is if they are removed with very high speed and not enough water, you can create a lot of heat. It's a metal, and you're actually taking them out with the metal burr. So you can create tremendous amount of heat when you're removing them. And I would say that would be the biggest cause for this. If you can find a dentist that has perhaps an electric handpiece that can reduce the RPMs, use a lot of water, and segment your amalgam rather than grind it out, your chances of running into trouble decrease significantly. The other problem, which is a minority of the times, is that many times amalgams have created fracture lines. We call them often hairline fractures when we are actually not able to see them with the naked eye. And sometimes they are visible. And when you actually remove the amalgam, those fractures that were hairlines relax a little bit because you've removed what was actually holding them together in a way. And then you tend to have sensitivity or whatever. But this is a problem that is going to manifest itself no matter what if you leave them in. You'll end up cracking your tooth and it'll be the same problem. So I would just find a dentist that uses an electric handpiece, that will use lots of water when they're removing them, and that knows how to segment an amalgam so it gets removed in chunks rather than drilling them out. So it's not inevitable that you were going to have problems if it's done properly. You're welcome.
Okay, well, I think we'd all like to join hands and say thank you very much to Dr.
Thank you so much.
Vinograd.
Appreciate it.